Erectile dysfunction and disorders of the prostate, presented by Catherine Longo, RN, BSN, University of Texas at El Paso, Master's Class Nursing 5372. Erectile dysfunction. Erectile dysfunction is the consistent inability for a man to attain or maintain a sufficient rigid penile erection for sexual performance. An erection occurs when blood flows into the cavernous and spongy tissue that runs along the entire length of the penis. Muscles, arteries, veins, and nerves work together to maintain an erection. Erectile dysfunction happens when there's a physiological or psychological disturbance in the body, such as lack of blood flow to the penis. There are three types of erectile dysfunction. Primary erectile dysfunction occurs in a man when they have never had the ability to have an erection during sexual activity. It is a lifelong occurrence. Secondary erectile dysfunction is when a man has had the ability to have an erection during sexual activity in the past but can no longer have one. It is the most common type of erectile dysfunction. Situational is problems having an erection on certain occasions, such as with a new partner or when there is performance anxiety. There are different severities of erectile dysfunction. There is maintaining versus attaining an erection, and there is chronic, occasional, or situational. This graph shows and breaks down that 52% of men that suffer from erectile dysfunction. This graph breaks down the types of erectile dysfunction that they suffer from. There are different causes for erectile dysfunction. Loss of libido, which could indicate a deficiency in the androgen hormone testosterone. Age is another cause. More than half of men between the ages of 40 and 70 experience it. The most common factor for men between the ages of 55 to 59 is age, and these men are 14% more likely to have erectile problems than men between the ages of 18 to 24. Poor blood circulation, particularly to the penis. People who are most likely to have erectile dysfunction because of this and are those with low blood pressure, blood clots, and or those with heart problems. Men that are on cardiac medications are also more likely because the cardiac medications can restrict blood flow. Stress is also a major cause of erectile dysfunction. It can be from problems from work or in their personal relationships. Pelvic trauma, surgery, or radiation increases a man's likelihood of erectile dysfunction. Alcohol, tobacco, and recreational drug use can also contribute to the dysfunction. 25% of sexual dysfunction may be drug-related. Behavioral sex therapy and counseling can also be used to treat erectile dysfunction. Lifestyle modifications and reduction of cardiovascular risk should also be done. Hormone replacement therapy can also be used. Some oral medications that are often prescribed are sildenafil, vardenafil, tadalafil, and avanafil. An injectable agent injected at the base and side of the penis to avoid injury to the superficial blood supply and nerve supply can also help to treat erectile dysfunction. Also, a vacuum erection device and penile prosthetic surgery are also used. This is a picture of a vacuum erection device used to retain an erection by someone that has erectile dysfunction. This is a picture of a penile prosthetic surgery to help those that suffer from erectile dysfunction have an erection. What else can you do to help prevent an erectile dysfunction? You should avoid smoking, exercise daily to maintain a good blood flow, eat a balanced diet, Drink alcohol in moderation or abstain completely. Drinking less may decrease anxiety about sexual performance. Create a relaxed environment before and during sexual activity, and maintain open communication with your partner. Remember, erectile dysfunction is very common and is treatable. Prostate disorders, BPH, and prostate cancer. What is the prostate? The prostate is a gland that is part of the male reproductive system that's main function is to make a fluid that goes into semen. This is essential for the fertility of a man. It is in front of the rectum but below the bladder. It has two growth stages, once during puberty and the second around when a man is 25 years old. After that, it continues to grow. This is a diagram to show where your prostate is located. It is below the bladder and above the rectum. Benign prostatic hyperplasia, or BPH, is when the prostate is enlarged but is not cancerous. This is the most common prostate problem for men over 50. As the prostate grows, it presses and pushes against the urethra. Eventually, the wall of the bladder is affected, and it may weaken and cause the bladder to not be able to empty completely of urine. Urinary retention and narrowing of the urethra causes many of the problems associated with BPH. Who has BPH? 20% of men 41 to 50 years, 50% of men 51 to 60 years, and 90% of men over the age of 80 suffer from BPH. The men most likely to have BPH are those that have family history of it. Also men over 40 years, men that also have medical conditions such as obesity and diabetes type 2, lack of physical exercise, and men that also suffer from erectile dysfunction. The symptoms of BPH are urinary frequency, which is going 8 or more times a day. Urinary urgency is that you can't delay urination. Having trouble starting a urine stream. A weak or interrupted urine stream. Dribbling at the end of urination. Nocturia, which is frequent urination during times of sleep. Urinary retention. Urinary incontinence. Pain after ejaculation or during urination, and often the urine that has a strong color or smell. To diagnose BPH, a personal and family history will be taken by your doctor. Also, a physical exam to check for discharge from the urethra, enlarged or tender lymph nodes in your groin, swollen or tender scrotum, and a digital rectal exam will be done, which is a physical exam of the prostate. Some medical tests that might also be performed are urinalysis, a prostate-specific blood test, urodynamic tests, which are a variety of procedures that look at how well the bladder and urethra store and release urine. A cystoscopy procedure might be done. This is a procedure that uses a tube-like instrument called a cystoscope to look inside the urethra and the bladder. Also, a transrectal ultrasound and biopsy might also be performed. The treatment for BPH are lifestyle changes, the reduction of liquids, particularly before going out in public or going to sleep, avoiding intake of caffeinated beverages and alcohol, preventing or treating constipation, and then also some medications. Some medications that are used for BPH are alpha blockers. These medications are used to improve urine flow and reduce bladder blockage. Some examples are Hytrin, Flomax, and Cardura. Phosphodiesterase 5 inhibitors is a drug mainly used in erectile dysfunction but can reduce lower urinary tract symptoms. An example of this one is Cialis. 5-alpha reductase inhibitors can prevent progression of prostate growth or actually shrink the prostate. An example is Proscar or Avodart. If severe BPH is found, a TURP procedure might be done. This is a surgery performed by a urologist that uses a resectoscope to reach the prostate and cut pieces of the enlarged tissue with a wire loop. Special fluid that carries these tissue pieces into the bladder, and the urologist flushes them out at the end of the procedure. This is the most common surgery for BPH. There is no way found yet to prevent BPH. There is no evidence that eating a specific diet either causes or prevents it from happening. Prostate cancer is the most common cause of cancer in men in the U.S. It is the second leading cause of death from cancer in men. It is rare in men younger than 40 years old. The risk factors for prostate cancer are being over 65 years old, a family history of prostate cancer, or being African American. In the early stages of prostate cancer, there are often no early signs and symptoms. Once it is more advanced, some of the symptoms are problems passing urine, either difficulty starting or stopping the stream or dribbling, pain with ejaculation, blood in the semen, discomfort in the pelvic area, bone pain, lower back pain, or erectile dysfunction. Prostate cancer that is detected early, when it's still confined to the prostate gland, has a better chance of successful treatment. The cause of prostate cancer is that cells in the prostate become abnormal and then grow and divide faster than normal cells. These abnormal cells then form a tumor. Some organizations recommend men to begin being screened for prostate cancer in their 50s or earlier if there are risk factors. Another test that might be done to check for prostate cancer is a digital rectal exam to feel for abnormalities in texture, shape, or size of the prostate. A prostate-specific antigen blood test may be done, in which higher level than normal levels may indicate prostate infection, inflammation, enlargement, or cancer. Also, a transrectal ultrasound or biopsy of the prostate may also be done. Treatment depends on how fast the cancer cells are growing. In early-stage prostate cancer, treatment may not be right away. Doctors sometimes recommend active surveillance, including regular follow-up blood tests, rectal exams, and possible biopsies to monitor progression of cancer. Radiation might be done to treat prostate cancer. This kills cancer cells. Surgery to remove the prostate might be done, or cryosurgery to freeze tissue to kill the cancer cells is also another choice. Hormone therapy is also another choice to treat prostate cancer. This is used to stop the body from producing testosterone, which the cancer cells rely on to help them grow. Cutting off supply may cause the cancer to grow more slowly. One hormone is luteinizing hormone or estradiol hormone agonists. These prevent testicles from receiving messages to make testosterone. Anti-androgens prevent testosterone from reaching cancer cells. They also might remove the testicles to reduce testosterone in the body.